My name is Jessica Nickel, and I'm with the Addiction Policy Forum. So excited you could join us for Strategies Advancing Recovery Supports Nationwide. Addiction Policy Forum has had a series of these types of convenings and meetings on addiction issues for almost 3 years now. This has been part of the process that helped in the sort of building and the policy development for the Comprehensive Addiction and Recovery Act. And we're so excited to have so many amazing speakers that can talk to you in depth on one of these core pillars that constitute a comprehensive response to addiction, which is recovery. A few thank yous to start with. This event is sponsored by the Addiction Policy Forum, along with Faces and Voices of Recovery and the National Criminal Justice Association. So I have a special thank you to Senator Chuck Grassley, Chairman of the Judiciary Committee, who is hosting this event and has helped make this possible today. He's also a key champion of CARA, Comprehensive Addiction and Recovery Act. Our other co-hosts include the Bipartisan Task Force to Combat the Heroin Epidemic, the Addiction Treatment and Recovery Caucus, Senators Sheldon Whitehouse, Kelly Ayotte, Rob Portman, and Amy Klobuchar, and Congresswoman Annie Kuster, Congressman Frank Guetta, and Congressman Tim Ryan. So we have quite a number of champions on both sides of the aisle that have made both CARA and the focus on the heroin epidemic, the opioid epidemic, so pivotal this Congress, and we're very grateful to their leadership, to them for their leadership. As you know, CARA, which was signed into law in July, and represented, I think, a real landmark piece of legislation to deal with addiction, and also laid out a framework for a comprehensive response that includes 6 key pillars: prevention, treatment, recovery, overdose reversal, law enforcement strategies, and criminal justice reform. Today, we're going to take a deep dive into one of those really important pillars, which is recovery support. We are joined by some of the MVPs from recovery nationwide that can really, I think, lay out how important this component is in a comprehensive response, how diverse the interventions can look like, and how much success that they're having in our communities nationwide. So I'm going to start by introducing Patty McCarthy, Metcalf. She is the Executive Director of Faces and Voices of Recovery, and she comes to Faces and Voices from the Center for Social Innovation, where she served as the Deputy Director of SAMHSA's Bringing Recovery Support to Scale TA Center. She was also the Director of Friends of Recovery in Vermont, a statewide recovery community organization, and Patty is a woman in long-term recovery from alcohol and drug addiction since 1989. So thank you so much for being here today.
Thank you, Jessica. We're incredibly fortunate to have this partnership with Addiction Policy Forum to bring more awareness to what we do in the recovery support services world. And Faces and Voices of Recovery began in 2001, so we've been working on policy issues and bringing a voice to recovery for 15 years. And as the nation's leading addiction recovery advocacy organization, we developed a network of recovery support organizations. So the network connects folks around the country that are providing peer-based recovery support services. So as Jessica said, I'm a woman in long-term recovery, and for me that means I haven't used alcohol or drugs in over 26 years. So the people that provide these services are also people in recovery, and the end goal for all of this work is to help people maintain recovery for the long term. So, next slide. Tell you a little bit more about the next slide, please. Here. So recovery community organizations, RCOs for short, are organized and led by the recovery community. They made up of representatives of the local recovery community, and they're diverse. They cover all pathways to recovery. That's one of the primary principles of recovery community organizations, that they support not only a 12-step-based recovery, medication-assisted recovery, faith-based recovery, natural recovery, all sorts of recovery, and that is embraced in these recovery community organizations. They have 3 main functions: public policy and putting a face on recovery, bringing voices to policy issues in their own states, in their own communities, and here on the national level. So they're also developing advocates and leaders within their organizations, opportunities, and how to get their message. They also provide peer-based and other recovery support services. So that includes a lot of everything that you're going to hear today and then some. There's a whole diverse range of services that can be provided. Next slide. So as I mentioned, at Faces and Voices of Recovery, we have an association called ARCO, the Association of Recovery Community Organizations, and we now have over 100 organizations, not just in the U.S., but internationally, Canada, Denmark, United Kingdom. So we're expanding on this model, and lots of countries and other groups are interested in developing these. So this represents the 37 states, and it is a national movement. Some of these are national, and they're growing their own chapters around the country, and some of them are local, like in the city of Dallas, or they cover the whole state, like Voices for Recovery, Wisconsin. So, next slide. So as you see, there's a map right there of where they're all located in the United States. You can go to our website, see if they're in your state. Just scroll over it. You'll see the names of the organizations pop up. Next slide. And I just wanted to mention that there are so many diverse services that are provided by people in recovery at recovery community organizations. There are telephone-based recovery support, so that's where people are receiving check-ins once a week from people maybe who are in recovery, but folks who are leaving treatment, leaving incarceration, will have phone checkups. There's many different self-care and wellness approaches. There are recovery community centers, so most RCOs, a lot of RCOs have centers where people come to. Some of them do work out in the community and don't have like a recovery center, but all of them are providing services driven by peers, people in recovery. Next slide. And lastly, I just wanted to mention that we did a survey of thousands of people in long-term recovery several years ago, conducted by Dr. Alexandra Lade, and it's called the Life and Recovery Survey. And the results of that survey said that these were the key ingredients to sustaining recovery. And that's what these peers, these people in recovery and the recovery community organizations are working on. They're helping them to find safe and affordable housing, employment, health and wellness. They're getting people to the doctor that haven't been to a primary care physician in years. They're helping them get their sense of belonging in the community, giving them civic engagement, helping them register to vote, become part of their community, and helping them with those basic needs along the way, at the same time helping them maintain their recovery. I think that's all from me. I just wanted to, my main message is that when we hear about a comprehensive response, we talk about prevention, treatment, recovery, which is not just the broader concept of recovery, but what we're talking about is our non-clinical, community-based recovery support services. That's very different than the organized treatment network that's out there. These are peer-based or community-based recovery support services. So now I